Hey folks, so in this video we're going to be talking about pregnancy from, week 9 to week 40. So this is like the fetal stage of development when we were talking about the prenatal stages. So we're going to be talking about pregnancy. Most people think of pregnancy as lasting 9 months, but it is a little bit more complicated than that. Typically, a full term pregnancy lasts about 40 weeks or 280 days. And this kind of depends on when you get pregnant, which months they are, because some months are longer than others. And then, you know, so it kind of ranges between could be this or could be that. And of course, the baby's due date is always a little bit up in the air. So, anyway, both are normal and healthy. Some important things to remember as a new mother throughout the pregnancy is to have regular prenatal checkups and care to monitor the health of the baby and you as well as the mother if you are um, a mother. But of course, you always want to be consulting with your doctor so that they can give you the best information for you. Healthy habits such as eating nutritious foods, staying hydrated, taking vitamins, and avoiding harmful substances can help support a healthy pregnancy. Mental health is also important, and when we get to labor and birth and all of that, we'll briefly talk about the baby blues and things like that. So the first trimester lasts from conception or fertilization to 12 weeks. And this is similar to about the first 3 months of pregnancy. So during this time, a fertilized egg changes from the tiny group of cells, the blastocyst, into the fetus with recognizable human features. This first trimester is often exciting, but is also challenging because many people experience symptoms like morning sickness, nausea, and fatigue. So the first trimester is weeks 1 through 12, and this is when the baby's major organs are beginning to form. The placenta is developing and providing nutrients and oxygen to the baby. And this is when we see many of the pregnancy symptoms begin. So, some things like morning sickness, nausea, like we've said before, feeling tired, tender breasts, frequent urination, any mood changes, food cravings, or even like aversions or not wanting to be around certain foods or smells. And this is because the baby is developing important organs, and it's especially important to avoid alcohol, smoking, and any negative substances that could affect development. Make sure that prenatal vitamins with folic acid are taken because this can help support a healthy growth of the baby. In the future, I will create a nutrition video, and so we can learn more about like why is folic acid really important. Um, so month one, this is weeks 1 through 4, and this is even before, like, believe it or not, the first 2 weeks of pregnancy happen before fertilization even occur. And that's because when you think about the menstrual cycle and what we learned about that fertilization period, right? It needed those 2 weeks before in order to create an environment where the blastocyst would implant. So during this time, it's a lot of different changes. Your body is getting ready for that possible pregnancy. We understand that hormones level change, and the uterus is preparing for implantation those 2 weeks prior to fertilization. So at the end of the second week, one of the ovaries releases an egg, and this is ovulation. Again, if the sperm cell meets the egg after ovulation, fertilization can occur and the pregnancy begins. So, this is about the first month of this. So week like 2 is when you notice that the period is late. And then those following weeks are, the implantation and the zygote forming. Um, so month 2 is weeks 5 through 8. And the second month is when many people realize that they're pregnant. So like those first, here's math, right? 2 weeks after you have that fertilization, you notice that you don't have your period. So you also notice pregnancy hormones are increasing rapidly. And around the 5th month, you can take an at-home pregnancy test, and it will usually show the result, whether it's positive or negative. And you can take multiple tests too, they say. But to be absolutely 100% sure, you need to consult your doctor. And it just makes sense to do that anyway, because you need to prepare your body if you have not already started to. So this is when people may experience those pregnancy symptoms. Like we said, around the 2nd month, the fetus is about half of an inch to an inch, or the size of a black bean, if you can kind of picture what that might be. So month 3 is weeks 9 through 12. And this is the time of rapid growth and development. At this point, the embryo is now a fetus. We know that. And during this month, the fetus is developing more of those facial features, the limbs, bones, muscles, and about the end of the 12th week, the fetus's biological sex has been determined. Although right now you cannot see it on an ultrasound. I believe it's around week 20 that is when you can determine. At the end of the 3rd month, the fetus is about 2.5 to 3 inches long, or about the size of a plum. So that is the first trimester. If some of these terms didn't make sense, you might want to go back and watch some of the other videos. Next video, we're going to be talking about the second trimester.